Erectile dysfunction affects around 50% of men by the age of 70. It's an uncomfortable topic, but one that you shouldn't ignore, especially considering ED can be an early sign of heart disease. Today, you'll discover 7 vitamins to fix erectile dysfunction. We'll explore supplements and food sources that can have a huge impact. You'll learn about an everyday food which improved blood flow by 22% in one study, potent teas, tips to boost your testosterone, and safety considerations to think about before supplementing. First up, L-arginine. L-arginine is crucial for producing nitric oxide, a compound that relaxes blood vessels and improves circulation. Since erectile dysfunction often stems from poor circulation, boosting nitric oxide can enhance your ability to get and maintain an erection. ED is often called the canary in the coal mine because it can be one of the earliest signs of cardiovascular disease. The same problems that cause ED can also lead to heart attack and stroke. L-arginine can help with both. Studies show L-arginine significantly improves ED, especially when combined with other compounds like pycnogenol. More on that later. Pistachios are a great source of L-arginine. In one study, men with ED who ate 100 grams of pistachios daily for 3 weeks saw remarkable improvements in erectile dysfunction and a 22% increase in blood flow. Other good sources include turkey, chicken, and peanuts. For supplements, common doses range from 1 to 5 grams per day. However, L-arginine can cause issues for people with asthma, liver or kidney disease, and low blood pressure. Some may experience mild gastrointestinal discomfort, so start with a lower dose and always consult a healthcare provider first. Next, Panax ginseng is also known as herbal Viagra. Panax ginseng is a powerful herb used in traditional Chinese and Korean medicine. It's known for boosting energy, reducing stress, improving cognitive function, and enhancing sexual health. The root contains active compounds called ginsenosides, which are believed to be responsible for its therapeutic effects. Beyond improving blood flow, ginseng is also known as an adaptogen, meaning it helps the body balance stress hormones. And of course, balanced stress hormones can further improve sexual desire and performance. Furthermore, studies show that women also benefit sexually from Panax ginseng. Panax ginseng is available as a supplement or as a tea. Standard supplement doses range from 200 to 600 milligrams per day. However, it's not recommended for people with certain conditions like high blood pressure or insomnia, because it can be overly stimulating. So again, talk to your doctor first. At number 5, we have L-citrulline. L-citrulline comes from watermelon. However, it can be hard to consume enough to get therapeutic effects. It's an amino acid that converts into L-arginine in the body, which, as we discussed earlier, boosts nitric oxide production, improving blood flow. Some studies suggest that citrulline may be more effective than arginine supplements, making it a potent option for improving blood flow and combating ED. L-citrulline supplements are generally well tolerated, with doses around 1000 to 3000 milligrams per day, or enjoy some watermelon for a natural boost. At number 4, we have horny goatweed. Yes, you heard that right. Horny goat weed. This herb got its name from an ancient Chinese legend. A farmer noticed increased sexual activity in his goats after they grazed on the epimedium plant. Since then, it's been used in traditional medicine for sexual health and vitality. The epidemium plant has over 50 species. Some are used for general energy and immunity boosting. However, for ED specifically, you want to look for the grandiflorum or sagittatum varieties. The active compound is called icarin. Icarin works similarly to Viagra by inhibiting the PDE5 enzyme, increasing blood flow to the penis. You won't find horny goatweed in everyday foods. It's typically brewed into a tea. While generally considered safe, it can cause side effects like dizziness, dry mouth, and nausea in some people. More importantly, it can interact with blood thinners, blood pressure medications, and may affect hormone-sensitive conditions. If you're taking any medications, talk to your doctor before trying horny goatweed. For other libido-enhancing teas, consider green tea for improved blood flow or fenugreek tea for testosterone support. We've got another testosterone booster shortly, but first we have the sunshine vitamin, vitamin D. If you've watched any of our other videos, you'll know that vitamin D is one of the most important vitamins for heart health, and one that many people don't get enough of. Vitamin D helps stabilize and repair endothelial cells, which line blood vessels. This improves blood flow, which is crucial for erectile function and your entire cardiovascular system. Plus, it helps regulate blood pressure. Unfortunately, vitamin D deficiency is extremely common, with research showing that 41% of Americans and 57% of UK adults have vitamin D levels below the optimal range. In colder countries like Sweden, that figure skyrockets, especially during winter. But before you rush out and get a vitamin D supplement, it's important to know that excess vitamin D from supplements can be dangerous. Excess can lead to calcium buildup in the arteries, increasing your risk of heart attack. So it's best to get your vitamin D through natural means if possible. Sun exposure is the most effective source, as your skin produces vitamin D3 sulfate when you're in the sun. D3 sulfate is the most potent form of vitamin D, with studies showing it has a unique ability to boost the exclusion zone around cells. The exclusion zone is a protective barrier. It's like a water-filled bubble that wraps around your cells, keeping out unwanted substances and allowing cells to work more efficiently. For optimal results, aim for regular, moderate sun exposure, focusing on large areas of skin like your chest and back. Plus, you get the extra benefit of a healthy tan. Of course, don't stay in the sun long enough to burn. Beyond sunlight, you can get small amounts of vitamin D from fatty fish like salmon, mackerel, and sardines. Pasture-raised eggs also provide a decent amount, as well as mushrooms grown in sunlight. If you think you're not getting enough, ask your doctor for a blood test for vitamin deficiencies. If needed, they can prescribe a supplement in the right amount. But don't just go out and buy vitamin D supplements without professional advice. Coming in at number 2, we have zinc. Low levels of zinc are associated with reduced testosterone, which can lead to ED and decreased libido. For most men, testosterone begins to decline after age 30, typical at a rate of 1 to 2% per year. This decrease can lead to symptoms referred to as andropause, the male equivalent of menopause. Beyond sexual health, testosterone is vital for maintaining muscle mass and bone density, so lower levels can increase the risk of osteoporosis and fractures. Low testosterone can also contribute to fatigue, irritability, and difficulty concentrating. As you can see, keeping your testosterone levels in check is one of the best things you can do to stay strong and healthy as you age. You can boost your zinc intake naturally by eating oysters, nature's richest source. Other good foods include beef, pumpkin seeds, and lentils. When it comes to supplements, the recommended daily allowance for adult men is 11 mg. However, for treating erectile dysfunction, some studies have used higher doses of 30 mg per day. But just like vitamin D, too much can be troublesome. Excessive zinc can interfere with your body's absorption of other minerals, like copper and iron. So again, it's always best to get your zinc levels checked before supplementing. Other ways to keep your testosterone levels healthy include resistance training, especially weightlifting. Cut back on simple carbs like bread, pasta, and anything made from flour. and make sure you're getting plenty of quality protein and fats. Nutrient-dense fats like avocado, nuts, and olive oil can all work wonders for testosterone synthesis. And make sure you're getting plenty of quality sleep. As we age, sleep can often be interrupted for various reasons, but testosterone levels are significantly affected by poor sleep, not to mention other impacts on cardiovascular health and stress. Is this helpful? Please click the like button, click subscribe, and turn notifications on to see more videos as we release them. And at number 1, we have pycnogenol. Pycnogenol is an extract from French maritime pine bark. When combined with L-arginine, it has been shown to improve ED symptoms significantly. Apart from its role in improving circulation, pycnogenol is a potent antioxidant, which means it protects blood vessels from damage and supports overall vascular health. In one study, a combination of pycnogenol and L-arginine improved erectile function in 92.5% of participants after 3 months of treatment. For those with type 2 diabetes or high blood pressure, pycnogenol has extra benefit. A study published in the journal Diabetes Care found that 200 mg of pycnogenol reduced postprandial glucose spikes, that's blood sugar spikes after eating, by a whopping 19%. Considering that high blood sugar affects 38% of the adult population, many without knowing it, this signifies a major health win. Pycnogenol is well tolerated, with studies reporting no significant side effects. Of course, supplements have their place, but they're not the whole story. Next, watch our video on the worst foods that cause erectile dysfunction. Remember to click like and subscribe to see future videos.